Okay, we're good. So, hi, good morning, Daniel.
Good
Hello.
morning.
Good morning. So, how do we know each other?
We've literally known each other since freshman year of high school, I
Yeah.
believe. So
hmm
it's been a minute.
It's been a minute. Okay. So, can you introduce yourself and tell us what you do?
Okay. So I'm Danya, as Anna said earlier. I am currently a registered technologist for X-ray, but I am training in CT, which is what my job is at the moment. So as soon as I'm registered, I will be officially listed as X-ray and CT. And so yeah, I do CT scans and X-rays.
Okay, cool, cool, cool. Okay, so how did you first learn about this profession?
Okay, so when I was in college, well, like my thing as a kid, being a South Asian kid, was that I wanted to be a doctor. But in college, I fairly quickly, honestly, realized that I didn't want to do that. But for a while, I kept trying to push through, and mostly because what I did like was the sciences and healthcare. So I thought maybe I could get through it, but I realized that's not what I wanted. So my siblings and I, since they also work in healthcare, we did some research on different types of jobs. And my brother specifically gave me a list of things he thought would be good. And he was like, why don't you do some research and see what you saw? And then what specifically caught my eye at the time was MRI, actually. And then when I did research, I realized a lot of people start with X ray, which is how I got into X ray school. And then I realized I also like CT, which is why I'm doing CT right now. And I would eventually like to do MRI as well.
I'm right. Okay, so X-ray is like the basis of
Yeah,
everything, and
pretty
then
much everyone starts with X-ray. It kind of is essential.
okay. So what kind of education or training is required to become an X-ray tech?
Okay, so as of now, technically you only need an associate's and to get into the radiography program. So the one I went to was at Hudson County Community College, where you get an associate's of science as well as your X-ray certification. So you need to be in one of those accredited programs, and then from there, if you want to do advanced modalities such as me, you could eventually work in X-ray and get there from a separate program, or you can find a job that is willing to train you right away. And that's basically
Oh,
it.
cool, cool, cool. So can you walk us through your journey, like through school to your current job? How was that? Because I know you were telling me a lot of stuff like, oh my God, all these like exams and like quizzes all the time.
Oh, well, that's
And
specifically how my program was structured, which really was good because so our first no, not even our, yeah, our first day in on our orientation day, our my program director was like, I am a quiz person and test person. I will you see my face, know you're getting some type of test or quiz, which
okay.
was exactly what it is. Because she taught like half our classes at the time.
Oh my God.
And so the way they structured it was like every other day we saw her, I think. But then, so we'd see one teacher who did our procedures class, which is obviously a really important class. And then she did like everything else practically. So we'd have procedures, which would be a big test per chapter essentially. So we had a little more break. But then for her, we'd have quizzes every day on all this material. But it really was helpful because like it kept us on top of all the material, which is stuff we do need to know,
Mhm.
unfortunately, because she taught the subjects well that you don't really care about and stuff that
Oh
you
my
don't
God.
necessarily do every day, like image production. Like for the test, you need to know for the registry. I mean, you need to know circuitry to a degree. Like even
Mhm.
though we're not allowed to change the X-ray tube's light bulb ourselves, we still have to, for some reason, know
Oh, right.
what's going on there.
Yeah, I think I remember you telling me that. You're like, yeah,
Yeah, I
we
had.
don't do anything, but we still have to know.
Yeah, it's just one of those things where they expect you to know way more than you need to know. But
Yeah, and how
so
was the
yeah,
exam? Like what was it called again? And like could you just like describe that for like anyone that's
yeah.
in
So that's the AART radiography certification or registration. We usually just call it registry informally.
Okay.
um, but yeah, so that was it's 230 questions, I believe it was. Yes, and you have about a minute per question. So you do have like a lot of time, like without a doubt. It's like almost 4 hours because yeah. And you can take one break to like go to the bathroom, but your time is still going. Um,
Oh, okay.
yeah, I mean, I didn't go out. I told myself as soon as I sat there, I was not getting up until I was done. I mean, from all the practice tests we took, it only I knew it wasn't going to take me like too long. I think I was done within like an hour and a half.
Oh my
So
God. So like a 5 hour test and you're done like in the first
I
hour.
mean, it's like it's pretty like I think the average rating is people are done within like an hour and a half to two.
Oh, okay.
Yeah.
Okay, so they
Although
give
my
you like five
friend who
hours.
was my friend who was at the site same test taking site as me, his appointment time was like right before mine. He took the full 4 hours. He went through the whole test again. So that was because I was especially because I was waiting for him and I was like, is he okay?
Oh my
He
God.
passed though, so he's great. He just was nervous.
Okay. No, I
He's
totally get
also
that.
out here doing his job.
Oh my God.
Um, yeah. So wait, what was the point? Oh, so I was talking about the test. So yeah, 230 questions. Technically, 30 of them don't count. You just don't know which 30 those are. Those are meant to like to test new types of questions they want to do, if that makes sense. So it's like we're the guinea pigs during the test, and it's to see. But you really can't tell honestly which ones they are. So you have to focus on all 230. But yeah. Oh, and then one nice thing is you get a perspective exam score, which basically you can know if you passed at least right away.
Oh, okay.
Yeah. So
That's wonderful. Like, because
yeah. So yeah, I knew as soon as I got like I was done.
yeah, when I took the NCLEX, I think it was like about a month or something. I can't really remember, but it was a while until I like got to know
Yeah,
my
I remember you
results
told me, and
back.
I think you have to like pay if you want to know like sooner, right? Which is crazy.
Um, I think so. I actually don't remember.
I just heard of
It's
that.
been
Obviously, I
such a
don't know.
long time that my
Mm-hmm.
like kaput, honestly. Oh my God. So I also wanted to ask you, so what does a typical day look like for you?
For me,
Mhm.
it's based. Well, so I work at an outpatient setting, and since I spend most of my time at another site, not my main one at the moment, because I'm still cross training in CT and getting cases. So their way, so I do focus on CT there, but so the CT schedule is all by appointment for them. It's no walk-ins, which makes sense.
Yeah.
The X-ray is all walk-ins.
Mhm.
So usually you go by CT schedule first. You go in, you do we open at 8 and then are done by 3:30 technically the CT schedule,
Mhm.
just the way it works. And we have 15-minute appointment slots. So according to that, we could have, if it was full day, you could have up to like 16 patients. We're just going, including some patients with contrast, which takes longer. So basically you check the schedule. Usually we try to look at days a couple of days ahead for the schedule so we have an idea, especially for contrast patients, to make sure all their labs are in and stuff. So that is usually set already. Like we'll have that written down for our own sake. You go through the schedule in the morning when you come in, try to come a few minutes early, see that, especially because since I start at 8 a.m. and the appointments also start at 8 a.m., you want to make sure if someone's there early that you can start them right away. So it's kind of like that. And then as x-rays come in, we kind of just split it up between the teammates to see what works. So it's just kind of just going through each appointment, making sure you're not falling too behind, that kind of thing.
Oh, okay. Cool, cool, cool. So you do both X-ray and CT, or are you just doing CT
Yeah,
right
that's
now?
how it is.
You're doing okay,
That's how it is at Atlantic Health, or at least the outpatient settings. We do
both.
X-ray as well. Yeah,
Okay, okay.
yeah, which isn't like too bad, especially because we haven't. We mostly just we don't get too many patients like that, and also because I get to keep on top of X-ray since I got directly into CT, so it's not too bad.
Mhm. Wait, so what are the most common types of like X-rays and like CTs that you perform?
Uh, yeah, since it's an outpatient, the most common X-ray will always be chest. Even honestly, in a hospital, that would be the most. That is our bread and butter as an X-ray tech is a chest X-ray.
I want to pause you for
Because
a second because this this car is just like honking like crazy.
oh,
Okay.
that's funny because you can't. I can't hear it at all.
Oh, you can't hear it at all? Oh, okay, then. All right. Okay, we'll just keep going. Sorry.
It's fine. So yeah, so chest X-rays are every X-ray tech's bread and butter, including an outpatient one. So we get a lot of those because you get those for kind of anything. One of the main reasons you get a chest X-ray is shortness of breath, asthma, pre-op, employment, school stuff. So kind of it's pretty basic. So that besides that, our site I noticed specifically gets a lot of abdomen x-rays, which is interesting because those aren't as common usually in outpatients. But I did notice it's because we are very our ultrasound department is very big and almost always fully booked, and usually they want an abdomen x-ray along with this specific type of ultrasound that I can't tell you in detail about because I don't even know. But
Oh.
they always want abdomen X-ray along with that. So
Mm.
that's kind of X-rays. And then CT wise, we get a lot of chest, abdomen, pelvis in those different categories. Those are pretty basic exams as well. Sometimes we get a lot of contrast exams too with that as well. So those are the bases. Sometimes we get like more complicated stuff like different types of angios, like a pulmonary ulnar embolism and aneurysm study. Those ones, so like I said, they require contrast and they also require a little more work from the CT tech, like behind the computer screen to make sure everything's going right. But yeah, usually it's just chest, abdomen, pelvis kind of thing.
Okay, cool, cool, cool. So, what are some of the biggest challenges you face in your job, would you say?
Mm. Well, since it's an outpatient setting, the CT techs and the MRI techs have to do their own injections. And I mean, I've gotten fairly good at it now doing it, but it's still really early on. And
Mm.
then it always happens that when you're busy or running late, that there's going to be a hard stick, and you're just like, oh my gosh, I need this, and can only poke them so many times. That's like
Mm.
crazy. What we usually do is first person tries twice, and if you still can't get it, you get someone else. We do have some really good people, so usually we can get it, but worst comes to worst, we have our manager who's pretty cool with Morristown Medical Center because he used to
Mm.
work there, who's also with Atlantic Health. So he would be like, can you guys take them? Because we cannot get this.
Oh
And
my
we're near
God.
there. So yeah, that I've only seen that happen once
Once.
myself. And even the other techs said they only remember it happening like 2, 3 times maybe. So we do
Oh.
usually get it, but that can be a difficulty sometimes running late and trying to manage time, especially with IVs.
Mm.
Because even though contrast exams, especially because you need to stick the IV, is going to take longer, we still only have the 15-minute appointment slot. So, getting the patient, getting them dressed, getting them injected, and then doing the exam, it can be kind of tight. So,
Mm, okay, definitely understand. So, in your facility, like, do you work with other healthcare professionals, like doctors, nurses, anybody like that, or is it mainly just your team over there?
yeah, it's mostly just text, but we always have, at least during the day, we have a radiologist on site because we're not allowed to inject patients without a doctor on site who can, in case something
Yeah.
goes wrong, they interpret it. And also, it's good because sometimes we need to just double check the prescription kind of thing because no insult to doctors, but sometimes they don't know what they're ordering, and we need to double check. Because, like, for example, they'll order, let's say, an abdomen pelvis with and without contrast, even though the patient current blatantly only needs contrast, like only the with, they don't need the without, and we don't want to irradiate them unnecessarily. So it's our job to make sure everything's good. Sometimes we double check with the rad, like, is it fine if we just do the with? And they're like, yeah, yeah, that's cool. So yeah, we work with mostly us, the front desk people, to coordinate checking in patients and stuff. But yeah, and then the rad will help out once in a while. But mostly, yeah, it's just the checks.
The tax. Okay. All right. So I'm just going to ask you a couple more questions just to close out. But
Okay.
what would you say that you love most about your job?
I love that I get to interact with patients directly, but I don't have to deal with them forever, and not to be any kind of rude way. But that's the best part. And I do like, especially like sometimes as you're talking to a patient, it really clicks in your mind that what you're doing is actually really beneficial to them. Like, especially since like I said, I do a lot of chest, abdomen, pelvis. When a lot of times when a doctor is ordering like the full body like that altogether, it's because they want to check for metastasis of cancer. So a lot of times I'll hear as I'm like getting ready to inject them, I'm chatting with them, to help them relax, and they're talking about how like this is to see like their last follow up to see if the cancer has stopped, kind of thing. And I'm like, wow, I'm actually helping someone by doing this. So I do like that. But I don't think I'm strong enough to be that oncologist who would be them every step of the way, possibly telling them this is not working kind of thing.
Mhm. Yeah, I definitely know what you mean. Okay, my last question is what advice would you give to someone considering a career in like in X-ray, MRI, CT, all
Mm-hmm.
that?
So first of all, do your research on how it works because we always say this: tech jobs are not talked about at all, really. But even in high school, because really, you don't like you could go directly from high school into an associate's and get there so quickly to this without having to do all this extra schoolwork. So do your research early on if it's somehow intriguing to you, and then try to talk to people in the field because it's a very small community, even though you might not realize it. Everyone knows someone. So you don't want to burn any bridges, but it also will help you expand on your knowledge because someone will be like, oh, I know an opening here kind of thing. And I know that tech and they can give you some advice kind of thing, blah, blah, blah. So yeah, just do your research, communicate with people, and try to be friendly.
Got it. Got it. Okay, thank you so much for letting me interview you.
Of course.
All right, cool, cool, cool.